An outbreak of highly pathogenic avian influenza in chicken and turkey flocks has spread across 24 U.S. states since it was first detected in Indiana on February 8, 2022. Better known as bird flu, avian influenza is a family of highly contagious viruses that are not harmful to wild birds that transmit it, but are deadly to domesticated birds. As of early April, the outbreak had caused the culling of some 23 million birds from Maine to Wyoming. Yuko Sato, an associate professor of veterinary medicine who works with poultry producers, explains why so many birds are getting sick and whether the outbreak threatens human health. Approximately 23 million chickens, turkeys, and game birds in commercial and backyard flocks had been culled as of April 3, 2022, after bird flu was detected on their sites. Should people avoid poultry products until this outbreak ends? No, that's not necessary. Infected poultry or eggs do not enter the food supply chain. To detect AI, the U.S. Department of Agriculture oversees routine testing of flocks done by farmers and carries out federal inspection programs to ensure that eggs and birds are safe and free of virus. When H5N1 is diagnosed on a farm or in a backyard flock, state and federal officials will quarantine the site and cull and dispose of all the birds in the infected flock. Then the site is decontaminated. After several weeks without new virus detections, the area is required to test negative in order to be deemed free of infection. We call this process the 4 Ds of outbreak control: diagnosis, depopulation, disposal, and decontamination. Avian influenza is not transmissible by eating properly prepared and cooked poultry, so eggs and poultry are safe to eat. The USDA recommends cooking eggs and poultry to an internal temperature of 165 degrees Fahrenheit, 74 Celsius. Are avian influenza outbreaks happening more frequently around the world, or do we just hear more about them than we did 20 or 30 years ago? The dynamics of the spread of avian influenza viruses are very complex. HPAI is a transboundary disease, which means it is highly contagious and spreads rapidly across national borders. Some research indicates that detection of HPAI viruses in wild birds has become more common. Reports are seasonal, with a peak in February and a low point in September. There are ongoing outbreaks of HPAI in wild birds in Asia, Europe, and Africa. Many migratory bird species travel thousands of miles between continents, posing a continuing risk of AI virus transmission. In addition, we have better diagnostic tests for much more rapid and improved detection of avian influenza compared to 20 to 30 years ago, using molecular diagnostics such as polymerase chain reaction (PCR) tests, the same method labs used to detect COVID-19 infections. But how can we be certain that infected food does not enter the supply chain? Thanks for watching the Science Knowledge Center. Subscribe for the most interesting and latest science news on the internet.